entire summer to put together a comprehensive plan, to put the necessary resources in place and build the capacity we need to be ready for another wave of COVID-19. With the number of cases on the rise, it's clear that the next wave, it will come at us harder than the last one. It will be more challenging than before because the flu season is starting soon and people are heading indoors again. We're also tackling a backlog of surgeries and procedures. We want to avoid canceling those at all costs. These patients and their families, they're counting on these surgeries. And I'll do everything in my power as Premier to make sure these patients get the help they need, because we need to clear the backlog, and I will have more to say about that in the next few days. And at the same time, we need to ensure our hospitals are not overwhelmed by the next wave of COVID-19. Preparing for the second wave, it's our top priority. It's what we've been working on around the clock all summer long. Folks, we haven't taken a break. And today, we're sharing this part of our comprehensive fall preparedness plan. It sets out the steps required to deal with the second wave and keep our healthcare system strong. It's a plan informed by our health experts, the Chief Medical Officer of Health, and the entire command table. Given the size and the scope of this plan, we will take the next few days to walk through it, so each and every person understands how we're putting their health and safety first over the coming months. This is a plan that will ensure we can continue to count on our healthcare system when we need it most. And today, I'm proud to share the first pillar of our plan. The first pillar helps our hospitals maintain capacity through the use of the flu shot. The flu shot helps reduce visits to our emergency rooms and doctor's offices during this season. And this will help with keeping capacity in our healthcare system. That's why we're investing $70 million to deliver the largest and most comprehensive flu shot campaign in Canada's history. We've ordered 5.1 million doses for the entire province, and we're working to order even more. Anyone who wants a flu shot can get one. I'll repeat that. Anyone at all who wants a flu shot this year can get one. And I encourage everyone to please get their flu shot this year. It's absolutely critical. Folks, we need your help. It's the best way to protect you and your family, because the next few months will be critical. We know that a second wave is coming. We know that it will be more complicated than the first wave. We know it will be more challenging on the system. What we don't know is how bad it will be, how hard we will get hit, because that's up to all of us. We all have a part to play. And it starts with everyone getting their flu shot this year. So please, please make sure you get yours. It's never been more important. And as always, flu shots will be available in the coming weeks through your family doctor and at your local pharmacy. We're making high-dose flu shots available to seniors for the first time ever in pharmacies. And we're prioritizing them for long-term care homes, retirement homes, and hospitals to protect our seniors and most vulnerable. My friends, there's no excuses. We all have to do our part and help our frontline heroes by getting our flu shot. And that's why dramatically increasing flu testing this year is such a critical part of our fall preparedness plan. And I'm looking forward to releasing more about our plan over the coming days and weeks, because this plan, the steps we take as a government, our collective actions as a people, it will make all the difference in the world. And by working together, we can all stay safe and healthy and defeat this virus. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. For the past several months, our government has been hard at work to protect the health and safety of all Ontarians and ensure the health system's readiness for future waves of COVID-19. We've been working directly alongside our partners on the front lines to validate and improve this comprehensive plan. It's a plan focused on 6 key areas. Number 1, maintaining strong public health measures, including continued expansion of testing and case and contact management. Number 2, implementing the largest flu immunization campaign in Ontario's history. Number 3, quickly identifying, managing, and preventing COVID-19 outbreaks. Number 4, accelerating efforts to reduce health service backlogs. 5, preparing for surges in COVID-19 cases. And 6, recruiting, retaining, training, and supporting healthcare workers while also continuing to engage families and caregivers. Given the size and complexity of our fall preparedness plan, we will release details over the coming days, including the considerable progress already made in the plan's ongoing implementation. While our best defense continues to be our everyday actions to stop the spread, like physical distancing, face coverings, and staying home when ill, even with minor symptoms, we want to be prepared for any scenario. Flu season presents a new challenge to Ontario's response to future waves of COVID-19. The flu shot provides the best defense and has proven to reduce emergency department visits and wait times, helping to preserve hospital capacity for any surges in COVID-19 patients. That's why we're investing almost $70 million in flu shots to launch the largest and most comprehensive flu immunization campaign in Ontario's history. This campaign includes ordering 5.1 million flu vaccine doses. That's 700,000 more than the approximate use last year, with 1.3 million high-dose vaccine doses for Ontario's seniors. To make it easier for seniors to get vaccinated, this year, for the first time, the high-dose flu vaccine will also be available at participating pharmacies. I encourage everyone to get their flu shot when it becomes available in the coming weeks at family doctor and nurse practitioner offices, public health units, and participating pharmacies for anyone 5 years of age or older. Our government's top priority is to protect the health and safety of Ontarians. I look forward to sharing with you more details of how our plan is going to do this over the next several days. Thank you.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
First question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. Sorry, I was having trouble with my mute on the phone. I just wanted to ask, some people might be surprised that the first pillar is the flu shot. You do the flu shots every year. People are looking for more than this, don't you think, when the cases are rising as high as they are?
So Rob, this is a massive, massive plan. It's very robust. It's jammed with items, and we rely on folks like yourself and the media to get the message out. And by the way, you've all been doing a great job. You really have. You've been true partners in getting the message out. If we lay it all down at once, the message isn't going to get out to the people. So over the next few days, and I think it's the best plan for all of us, is to roll out one, roll out another and another, and people can comprehend it. If we just ram it down, on the table and just start rolling it all out, it's not going to be absorbed by the people out there, and that's the reason we're going to roll it out. But the flu part, I got to tell you, with the flu shots, it is so critical. Never before has the flu shots been so critical. Someone has a runny nose, or maybe your kids have a runny nose, and right away it's going to backlog the system again, and it's just better if we take the flu shots. We have the high-dose flu shots, and I'll pass this over to Minister Elliott. Thank you.
Well, the flu shot campaign is one of 6 elements of our comprehensive fall preparedness plan that we will be releasing over the next few days to the people of Ontario. And as the Premier indicated, it is something that is very important for the health and safety of all Ontarians, to protect yourself from getting ill from the flu. We have every year several thousand people who have to be hospitalized because of flu and flu complications. Last year, 280 people in Ontario died from the flu. So this is really important for the health and safety of Ontarians, but also to make sure that we can maintain capacity in our hospitals in order to be able to deal with the flu. it is an important element, and we will be talking about the other aspects of it as time goes on, but it is a very full plan. It is very comprehensive, and we know that people in Ontario are anxious about the rising case numbers. We want people to understand every aspect of the plan and how we have considered all of these issues in advance, and we have prepared for it. We have been working through the summer on this plan. Many of its elements have already been introduced or are in place, but we do want Ontarians to receive the full picture, and that's why we are going to take several days to reveal each aspect of it, because it is a very integrated, complex, and comprehensive plan.
Follow up.
Yes, thanks for those answers. Just to switch gears a bit, now that we're nudging up against 500 cases, which we haven't been at since we were in a big lockdown in early May, yesterday Barbara Yaffe, the Associate Medical Officer of Health, was saying that other measures to quell the spread are being actively considered. So I'm wondering what is on the table right now in terms of other measures you might want to take in terms of restrictions, perhaps? Are you thinking of closing bars earlier, limiting the number of people in restaurants, even perhaps collapsing the social bubbles or the social circles?
Yeah, I'll hand that back to the Minister. Thanks, Rob.
Well, we have already taken several measures, as you know, first of all, indicating that for 2 incubation periods, several weeks, we are not going to be introducing any new measures to either in terms of social contacts or in businesses reopening. But we also have taken the measure to reduce the social gatherings, unmonitored social gatherings, to 10 inside or 25 outside. We are receiving daily reports about the outbreaks that are happening in different parts of the province. We have our eyes closely monitoring all of that, and there are several opportunities that may be available in the future that we may have, other steps that we may have to take. We don't have anything specific that we're prepared to move on right now, but we are looking very carefully at several different scenarios. And the health and safety of Ontario's people is our top priority. And so we will take whatever steps need to be taken, advised by our public health officers, Dr. Williams, and the people at the public health measures table.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Cynthia.
Hi there, Premier. My first question is about the private company that is advertising that if you want to avoid the long lines for COVID assessment, that you can pay some $400 and get tested and have the results in 12 to 24 hours. Is this a condemnation of your plan and the long lineups that people are seeing in Ontario? And also, I want to ask, how do you personally feel about this? Do you think that private companies should be allowed to offer this? What do you think personally about it?
Well, I think it's a free market society, but I encourage people to go to the testing centers. So we've pulled out all the stops, Cynthia. We have 10 pop-up testing areas. We have the assessment centers extending their hours. We have the hospitals extending the hours. And I got to give a shout out to these community paramedics. I love these men and women. I got to tell you, we have Chief Nolan that had the bus out in Ottawa. We had Chief Roberts down in Middlesex, and I'll tell you, they just take the bull by the horns. They don't wait for all the 18,000 signatures you need through the government. These are professionals. They're used to dealing with critical. When they come on a scene, they're used to just reacting and moving in a rapid fashion. I just want to give these folks a shout out. We want to roll this out right across the province. They're absolute champions. What I love, Cynthia, you don't have to talk to them. They just grab it and run with it. And they partnered up with a hospital in Ottawa. I think it was 1,300 tests they were able to get through. And I just want to give a shout out to all the men and women, all our paramedics. You never hear it. They never complain. All they do is go into action. And we're going to be there to support them. I had a conversation with Chief Nolan and I've had a conversation with Chief Roberts a while back. Just incredible. So we're going to take their lead, and they're going to run with us right across the province. That's going to be another area. Plus, then we have the pharmacies going to be up and running, by the end of this week, and we'll have further announcements about that. So it's all hands on deck. You know, Cynthia, we've faced so many bumps, and all of us as the people of Ontario, and we've always got through it. No matter what it is, we'll get through this again. But folks, I got to get back to this flu shot. It's absolutely critical. You'll take the load and the burden off the backs of the hospitals and the doc's office if we get our flu shot. It's never been more critical. Go out there, get a flu shot. I'll be first in line. You know, I'll get one, and I'm just encouraging every single person to get a flu shot for people that haven't ended up getting flu shots in the past.
Follow up?
Thank you, Premier. I've noticed that your mood seems decidedly more grim in recent days. You were certainly more buoyant a few weeks ago when the numbers were decreasing, not increasing. What do the latest modeling numbers suggest? And will you release them? The last time you got them, you did, because you said people deserve to know and you wanted full transparency. Will you release them, and if not, why not?
Well, before I pass it to the minister, I'm always encouraging our public health folks to come out and do the modeling, and I'm going to continue doing that. I can't answer for the chief medical officer. Yeah, I'm concerned, Cynthia. I really am. You know, we worked so hard, and we were below the 100, and all of a sudden we knew this was coming. I heard it was heading up towards northern Michigan now, and the numbers, you know, they're climbing 500, maybe 700, maybe 1,000, but it's all hands on deck. I was on the phone. I'm on the phone late last night, every night actually, at my office. I talked to Deputy Prime Minister Chrystia Freeland. We're both concerned, but we are sparing no expense. We're collaborating. And Health Canada, it's critical. And I know, Chrystia, you're doing everything you can. It's critical we get this rapid testing. It plays such a massive part in tackling this. And the rapid test, I know you asked me the BC, we're rolling that in this week to three hospitals, Women's College and UHN and Sinai, all three. So we're pulling out every stop. The rapid test, there's 6 or 7 being tested. We want to really push. There's one that I hear is Abbott. Please, Health Canada, nothing is more critical than getting this approved. I just can't stress it enough. It plays such a massive part in our testing. But folks, we're going to get through this together. We've got through everything else. We just all have to be vigilant, and please go get the flu test. I just can't stress it enough. So I'll pass it over to the minister. Thank you.
Well, the Premier and I are both very concerned about the rapid increase in numbers, as I know the people of Ontario are. But we do have a plan. We are putting the plan in place. We have planned for the worst. So we will have the capacity. We will have the ability to test, trace, and isolate for cases in the community. But it is really important as we do that, as we plan for an increase in cases and to be able to deal with an increase in cases, it's up to all 14.5 million Ontarians to please do your part to help us stop this community increase that we're seeing. It's vitally important for everyone to continue to follow the public health measures. We've said it many times, but we'll say it again. Please make sure to continue with physical distancing. Wear a face mask if you're not able to do that. Wash your hands frequently. And if you're feeling ill, even if there are mild symptoms, please don't go out. Please help protect your fellow Ontarians. That's the way that we're going to get this under control, along with the flu shot, which we're really appealing to everyone to get this year. These are the measures that all of us can take. I will be getting the flu shot as well. We need to all take these measures so that we can get these numbers down and stop this community transmission.
Next question.
Next question comes from Grace Macaluso from Automotive News Canada. Please go ahead.
Hi, Greg.
Thank you. I'd like to ask a question and supplementary about the Ford Unifor deal that was the tentative deal that was announced today. And Premier Ford, I'd like to ask you how much Ontario taxpayers will be contributing to Ford's $1.9 billion investment, and what do you expect in return?
Well, we're in the midst of negotiating. I want to congratulate Unifor and Ford for working together in protecting these jobs. These jobs are absolutely critical, not only the 3,000 jobs, it's the technology and having a facility that is the latest and greatest technology out there when it comes to electric cars. But more importantly than just the 3,000 jobs at Ford, it's they told me, I think it was 27,000 jobs that are making parts for that Ford plant. That even plays a bigger role. So I know we have the technology, we have the smarts, we have the ingenuity here, and we'll compete against any car facility in the world. And I always explain to people, and it's interesting, as much as these dealerships, so they compete against each other, you can go down the street and buy A car, B car from different dealerships. But what Ford has to do, and Toyota, Honda, Chrysler, GM, they come up with their plan, and we compete against other locations around U.S. And this one we were competing against Mexico, and they have to go to headquarters and sell Ontario, sell the reason why they should produce cars in Ontario. And we've given them a list as long as my arm, how we're going to produce the best cars in the world right here. We have the most efficient car plants anywhere in the world right now with the facilities we have. Number one producing car plant in the world is Toyota. They're in Cambridge and Woodstock. So we can do it. We're at the table, and once I find out the exact figure, I'll come out and talk to the people about the exact figure. I think it's a worthwhile investment, protecting people's livelihoods, and I'll always protect the frontline workers, always.
Follow up?
And my supplementary is, I just want a clarification. Did you say that Ontario is competing with Mexico for the Ford investment that was announced today?
Yeah, so we're competing against, I'm sure not just Mexico, but one particular facility, the Oakville plant. They told me that we'd be competing against Mexico, but we're better than Mexico. And it's not a slight against people from Mexico. They're great folks down there. But I got to protect Ontario. We have a better team, better technology. We've had the plant up there for 100 years. And that's what we're up against. And that's almost every deal we make. It's always 2 or 3 cities around the world that are competing against us, and we're winning. We're winning on these contracts, no matter if it's aerospace or technology or pharmaceutical. With Roche, another big pharmaceutical, we won against area in the U.S. and against Ireland because we just have better people. We really do. I mean that. We have the smartest, brightest people. And then the colleges and universities, the young students, the smart, brilliant kids they're pumping out of there. We have the best system in the world, bar none, and I believe this wholeheartedly because I've seen it firsthand.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Hi, Premier. Thank you very much. Is it possible, the minister mentioned there, yes, we are looking at some, various options or scenarios for the future. I'm just wondering, can you give some specifics of what is, potentially on the table if this current trend continues? And does that include, are there any imminent changes coming to long-term care, such as more resources being deployed or some other kind of new strategy?
Yeah, before I pass it over to the minister, we're pulling out all the stops. I was on the call late last night with the minister. I was on a health call this morning. There's nothing more of a priority than to protect our seniors in retirement homes and long-term care. It's the #1 issue, along with testing right beside it and getting your flu shot. So it's like 1, 2, 3, all side by side. No matter if it's getting the community paramedics, which I had the conversation, to be able to go in there, our IPAC teams, infectious control people, making sure that we have them there working with the hospitals. Keep in mind, 99% of our homes are clear, and we've had an outbreak in Ottawa. I want to thank the PSWs. Please continue to get testing. I know we can't force you to, but it's critical. We keep these homes safe, and there's 2 ways, and it's not their fault. It's 2 ways. The long-term care patients aren't getting it themselves. It's coming in from the outside. So we just have to hammer it down. I'll pass it over to the minister.
Our fall preparedness plan is a plan that is intended to be integrated with the work being done in other ministries. We want to support our partners in education with respect to, for example, the immunization of children for the flu shot, but also for our very vulnerable populations in long-term care homes, retirement homes that wish to have these facilities available, and other congregate living settings. This is really important so that we can protect the residents of those homes. They will be the first ones to receive the flu shots as soon as they arrive, which should be as early as next week. Then we will move for more with the general population and have the vaccine available in primary care physicians' offices as well as in the pharmacies. They're going to be able to provide the high-dose flu vaccines for the first time as well to people 65 years of age or older. But this is a plan that focuses on health, but also supports many other ministries in the work that they are doing as well.
And one other thing I want to add to that, Lucas. I talked about the HEPA filters, the technology with the HEPA filters to the health team and long-term care this morning. I said, whatever it takes, let's start moving the HEPA filters into these long-term care homes, the HVAC systems. We're doing it for the AC. We went through the old list of who has AC, and some modern homes have it and some don't, so it's critical. I'm just not chancing anything, absolutely nothing. I want to make sure that we think of absolutely everything and then implement it immediately. So I think the HEPA filters will play another role in this as well.
Follow up.
Thank you. And Premier, I wanted to get your response to a story from our partners at actually CTV Toronto, where an agency did an open house for potential buyers. They walked up and there was a note on the door saying, "Sorry, I'm sick," and it later turned out to be a person inside, a tenant, who later tested positive for COVID. The tenant was moved on a Saturday, but they continued showings with no cleaning on a Sunday. It's been taken down, and this is being looked into. But I'm just wondering, since this would be a breach of both Toronto Public Health and the Ministry of Health's own regulations, what you think an appropriate punishment would be here, and how it may fit into potential provincial enforcement.
Yeah, no, you know something, that's very unfortunate to hear that. That's the first time I heard about it, Lucas, and I know Public Health and Ministry of Health will be dealing with it appropriately, and I know Public Health, I'll mention as soon as we leave this press conference, they'll be addressing it. I just don't know all the details, so I'd hate to make a comment on that without knowing the details. But folks, you got to follow the guidelines and the protocol. We've never been in a more serious position than we are right now over the next few weeks, and we just need to follow. Everyone needs to pitch in, and everyone has, and everyone's helping out. And again, no matter, the media's done an incredible job. I thank you guys. I thank the people and the frontline healthcare workers. We're prepared. We're so much better prepared than we were before, no matter if it's PPE, protocols, guidelines, more testing, more nurses, more PSWs. It's everything's on the table right now. And finally, I know I'm going to sound like a broken record player, but it plays a critical role of two things. The rapid tests from Health Canada, I can't stress it enough, and get your flu shot, because it's going to hit us. It's like the perfect storm coming together.
Last question.
Last question comes from Miranda Ann Thistle from Global News. Please go ahead.
Hi, Miranda.
Hi, Premier. So out in BC, the list of symptoms parents need to check their kids for before they send them off to school has been shortened. They've taken 10 symptoms off of the list, and that includes a runny nose and a sore throat. And the Ministry of Health out there says it's because, there's a low probability these symptoms would exhibit COVID on their own. Now, many of the people we've seen here in line in Toronto have been parents with their kids. They've taken a day off work and a day off school to stand in the lineups for hours now. So would Ontario consider doing the same thing as BC and shorten the symptoms list, and perhaps easing the burden on the lineups at COVID testing centers?
Well, again, Miranda, that's a great question. That came up actually today, and before I pass to the minister, I have 4 kids, and in the winter, they always had runny noses. The kids have runny noses, and we always have to be cautious on making sure they get tested, and we're bringing on board the BC tests, the ones that you see the kids are gargling with salt water, and it takes a little bit longer than a nasal swab, but still, I think it's important. At least it gives us an idea, but I'll pass this over to the minister. Thank you.
Well, the Chief Medical Officer of Health and the Public Health Measures Table are in active conversations with the Ministry of Education on the symptoms issue. And if they revise the symptoms list from time to time, that's to aid in the discovery of children with COVID and to make sure that they can be tested, traced, and isolated. So that is something that will continue to go forward. We are this is a very new territory with COVID-19. We don't know exactly everything that it involves in terms of symptoms, so this will be an active conversation and we will follow up with it. But in terms of the lineups, for testing, we have made changes. We have significantly reduced the lineups in many areas, including Ottawa, for example, with the paramedic assistance and other assistance with having extended hours for opening for the assessment centers, pop-up assessment centers, and so on. We are going to continue to do that. And in education, of course, we have the public health nurses coming on board. Over 500 have now been hired, so they will be able to assist with the symptom review as well. If a child appears at school with some symptoms, they will be able to provide their professional review and examination of the child to determine whether further testing is needed or whether it's more of a cold that they have. So we're working on this on many fronts.
Follow-up?
Okay, my follow-up question is, how soon can people get the flu shot? What is the timeline for that? I know Premier sort of mentioned that people in long-term care homes, they'll be on the first in line to be able to get that. But what is the timeline for the general public to get a flu shot? And also, how close are we to saliva testing?
Yeah, so I'm going to pass this to the minister, but there's two types of flu. The extra strength per se, I'm simplifying this, extra strength and for the seniors and that, and then the regular flu. And then you're mentioning about the saliva testing. I'm pushing Health Canada. I know the Deputy Prime Minister is pushing, had a conversation this morning, late last night, and these are some of the things that we do behind the scenes. We're working together, and I'm just so grateful. We have a great partner with the federal government, but again, Health Canada, we have to get this moving forward. I'll pass the balance to Minister Elliott. Thank you.
Well, we do expect that the first shipments of the vaccine will be arriving next week. We should have the first shipment before the end of September. And as I indicated earlier, we will be supplying that vaccine to residents of long-term care homes, staff members as well, and to people in hospitals and retirement homes and other places of congregate living. This is a top priority to keep these very vulnerable citizens safe and healthy. But we also will have the vaccine available very shortly thereafter to pharmacies and primary care places, doctors' offices, nurse practitioners' offices, as well as public health units, so that they can also start to administer the vaccine very shortly thereafter. I would say no more than a week thereafter. We want everybody who is able to receive the flu vaccine to please do that. Anyone who's over 5 years of age can receive it in a pharmacy. Anything under 5 years of age will still need to be administered in a primary care practitioner's office. On the second issue with respect to saliva testing, we are continuing to push Health Canada to come forward with other versions of testing that will be more immediate. While saliva testing isn't as accurate as the testing, the nasal pharyngeal swabs that we're using right now, it can be good use for screening to determine whether someone needs to be followed up, whether they need to have the NP swab or whether they are all right to go. So different tests can be used for different reasons, but again, we are appealing to Health Canada to please move forward with this as quickly as possible.
Thank you.
That's great. Thank you, everyone.